Look at the case and answer me. What do you think it is? Anyone?
Endometrium.
Endometrium. Okay.
There was
What
a
else?
clot in endometrium.
I have paused it. What do you see on the screen? Anyone who can explain me? Don't be afraid.
Distended vagina.
Yes, it was there in the labeling. This is the distended vagina. What else can you see? This is the distended vagina. Screen. This is
Urinary
sagittal.
bladder also.
Yes, this is urinary
We are able
bladder.
to see the
This is urinary bladder in the longitudinal view, in the transverse view.
yes.
What else you all can see?
Sagittal endometrium also we can see.
Sagittal sec.
This is uterus. This whole thing is uterus. Uterus with cervix. Here is the endometrium. Here is your vagina, which is distended. This is transverse view of the vagina that is distended. And it contains what? It contains blood. What is the ecotexture? Anyone? Ecotexture. We studied it in our very first lecture, ecotextures. Common picture, very common picture. This should be here in your brain. It should be there. It should not go away. You should keep on repeating it in your brain, this picture. Whenever you see a young female or a married female or someone with complaints of gynecological, you have to start your view from vagina. And then you move upwards towards cervix and then to uterus. So this is very clear picture when you have a young baby, young female girl, young female or girl that comes to you complaining of pain in the pelvis area, unmarried, because in village side, you can find the Aadhaar card information is not correct. They are updated because of the legal procedures. So you have to be very careful whether you are looking at married or unmarried female, whether you are suspecting her age to be corresponding to your observations, ultrasound findings. You have to be very clear about it. So the basic clinical picture will be young girl comes to you with the mother and mother says she has pelvic pain monthly, once monthly, and this pain increases with every cycle. Means today, suppose in January, the pain was mild. Then in March, the pain was moderate. Then in June, the pain was severe. Why? Because she has attended menarche. She is going through menses. But because of some pathology in the vagina, she is unable to pass this blood externally. So this blood in the first menstrual cycle, the blood correction will be that she will feel little pain, but this blood is not going anywhere. It will be collected over here. So in the next cycle, this blood collection will keep on increasing. It will keep on distending the vagina and the pain will increase with each cycle. What are the causes of hematocolpus? Young, unmarried girl. What is the cause?
Hymen.
Imperforate hymen.
Imperfect.
Yes, very right. Very much true. Imperforate hymen, vaginal septum. These two are the basic things. Vaginal septum, imperforate hymen. So young, unmarried girl, most common cause is imperforate hymen. Now I'll show you another case. This is the transverse view of the uterus. This is the transverse view of the uterus. This is the uterus. Observe what you are seeing, observe. First video, this is the second video. This is the longitudinal view of the uterus. I'm giving you a hint. This is uterus. This is longitudinal view of uterus. Of the finding, this is the finding. This is another picture of the finding. I'll play it once again and you all tell me what did you see. This is transverse view of the uterus. This is the endometrium. This is the endometrium. This whole thing. And inside the endometrium, do you see anything inside the endometrium? These ecogenic, there is something ecogenic inside.